I'm Sergeant Strange and this is Mike 6. Evaluate and treat a casualty for a spinal injury and shock. Task: identify the signs and symptoms of shock. Evaluate and treat a casualty for spinal injury and shock. Conditions: you are a member of a platoon within a secure forward operating post in a non-CBRN environment. You are assisting another soldier with an injury to a fellow service member and preparing him or her for evacuation while waiting on the medical evacuation. The other soldier states that he or she witnessed the casualty fall from a guard tower. He or she suspects the internal bleeding and a spinal injury. He or she goes on to state that after initially acting fine, the injured soldier began complaining of nausea, difficulty breathing, and abdominal pain. The injured soldier is laying on a litter with long spinal board when you arrive and is alert to pain only. The uninjured soldier is available to assist you with spinal stabilization and movement of the casualty while you provide treatment. Standard: identify at least 6 signs and symptoms of shock with no incorrect answers within 1 minute. Apply cervical collar and spinal immobilization. Assess and treat for shock to standard in sequence within 5 minutes without causing further injury. Identify signs and symptoms of shock: sweaty but cool skin, pale skin, restlessness or nervousness, thirst, severe bleeding, confusion, rapid breathing, blotchy blue skin, nausea and or vomiting, low blood pressure, absence of distal pulse, and capillary refill delayed more than 3 seconds. Alright, next, applying a cervical collar and treat for shock. Step 1, apply cervical collar.
Have the other soldier kneel at the casualty's head and manually apply inline stabilization of the head and neck. Reassure the casualty and explain the procedure to him or her.
Okay, you're going to be okay. I'm going to apply a C collar.
Measure and determine the size of the collar to apply. The front height of the collar should fit between the chin and the suprasternal notch. Once in place, the collar should rest on the shoulder of the girdle and provide firm support under both sides of the mandible without obstructing the airway or any ventilation efforts. If the collar is too large, the casualty's neck may be placed in hyperextension. If the collar is too small, the casualty's neck may be placed in hyperflexion. Size the collar based on manufacturer instructions and apply the collar to a supine casualty. Ensure the other soldier maintains inline stabilization. Set the collar in place around the neck and secure the Velcro strap in place. Maintain manual stabilization of the head and neck until the casualty is immobilized on a long spine board. Immobilize the casualty to the spine board using the straps and head immobilization blocks. Assess for shock. Assess the casualty's level of consciousness.
Hey, you're right.
The casualty does not answer but reacts to pain. Evaluate the skin. Skin is pale and moist, abdomen is distended. Assess capillary refill on a finger. Capillary refill takes 4 seconds. Check for pedal pulse. Skin to skin, no thumb. You do not feel a pulse. Check for femoral pulse. Skin to skin, no thumb. You do not feel a pulse. Check for radial pulse. You do not feel a measurable pulse. Check for carotid pulse. You feel a weak but rapid pulse. Measure the pulse for 30 seconds.
Measure for 30 seconds.
Alright, assess respirations. The respirations are rapid but shallow. Measure the respirations for 30 seconds.
Measure for 30 seconds.
Treat for hemorrhagic shock. Position the casualty. Move the casualty under shelter to shade him from direct sunlight. Secure the casualty to litter before moving. Maintain the supine position and spinal immobilization. Treat for hemorrhagic shock. Loosen the clothing at the neck, waist, or anywhere it is binding. Prevent the casualty from getting chilled or overheated. Using a blanket or clothing, cover the casualty to avoid loss of body heat by wrapping completely around the casualty underneath the litter straps. Resecure the patient onto the litter. Calm and reassure the casualty and watch the casualty closely for life-threatening conditions.
It's gonna be okay.
Correctly record all treatments on the front and back of the TCC card and secure the TCC card to the casualty per unit SOP.